Hey everyone, Matt Petrie here, and I just got done watching the video with Dr. Dustin Calhoun from the University of Cincinnati Medical Center. And I liked a lot about what he talked about how hospitals firstly are brought into the loop when events such as a mass casualty event would occur, and how they are brought into the loop on everything that is going to happen. Talked about the role of UC Medical Center in the events such as mass casualty event, and about how communication is extremely important with both fire and police departments in events such as these, because they need to be informed of what's going on, who's going to be brought in, how many are going to be brought in, such as that. And he also talked about the shooting that occurred downtown either last year or the year before, and how they weren't really aware of what was going on. They didn't know anything was happening, and there just happened to be a firefighter on site, and as he was leaving, he was able to turn back around and tell them that they're going to have a couple people coming in with gunshot wounds, and that gave them that heads up that, okay, now we got time to prepare a little bit for what's going to happen, who's going to be brought in and everything, and what they need to do in order to be prepared for the trauma patients that are coming into the hospital. And he also talked about how there's two types of communication between hospitals and fire or police departments, and that there's the formal type of communication where they receive all of their information from dispatchers, and then there's the informal communication that comes from the officers or firefighters themselves that may be on site or that may be coming into the hospital. And then this is essential because UC Medical Center is also the only hospital in the greater Cincinnati area, or at least in Cincinnati itself, that has a trauma bay, and that they can receive patients who have gunshot wounds or that are trauma patients themselves. So they need to be made aware of immediately of if they're going to receive any trauma patients, because they don't want to be receiving patients that don't necessarily need that type of care, that can go to a different hospital in the areas such as Christ or Mercy Hospital. And then the impact of he talked about the impact of mass casualty events and how there are tiers of people that impact it, and that begins with pharmacies and labs and such as that, and it works its way up. And this also applies to my community, because there are not any hospitals in the immediate area, maybe in a couple mile distance around my area, that can hold trauma patients. And so this would be ideal to know where everyone needs to go if an event like that would happen in this area. If they can go to a hospital that doesn't hold trauma patients, maybe their injuries aren't as severe as a trauma patient would be, and then if that were the case, then they can be transported to UC Medical Center.